What is the definition of awareness?
Well, it's the state of being aware.
Thank you, me from the past, but dictionary.com is usually not the best resource to use. So there are a bunch of different definitions out there of awareness. Let's check out a few. First, the knowledge of perception of a situation. Okay, not bad. Knowing that something exists. Average. Feeling, experiencing, or noticing something. Pretty basic. A concern about and well-informed interest in a particular situation or development. Now that's getting to the heart of the matter. But first, to truly understand the definition of awareness, we need to check out some first-hand examples.
How you doing? My name is Daniel Orta. I'm from Miami, Florida. Grew up, born and raised there. Come from two immigrant parents. My mom from Colombia and my dad from Cuba. So I'm first generation, I guess, Hispanic American. So I'm here to talk to you about awareness specifically in the medical field. I'm a fourth year medical student, so my experience is not as thorough as it should be, but I'm getting there. Being in medical school, we encounter a whole variety of people from different cultures, different backgrounds, different education levels. And the biggest thing that our attendings harp on is patient education. It's one of the most important things, especially for someone to be compliant with medication. If you want to get better, you got to know what's going on with you. And we always say that's the first thing that you need to know. Just a little story, for example, today I was at the hospital with a patient. She had chest pain. And when we went to talk to her, we always have to ask questions about medical history. Do you have any heart problems? Anybody else in the family has heart problems, diabetes, whatnot? And what she revealed to us is that she had nausea or vomiting. She had trouble eating food. And she said that she's had it for many years. What we found out is that she had a disorder called gastroparesis, and that's a disorder which decreases the movement of the stomach, and that's usually caused by diabetes. So what we revealed today is that she actually had diabetes. Now, if she was properly aware of her situation, if she had a doctor that was following her and educated her on the risks of diabetes, being that she comes from a family history of diabetes, she would have known to be checked out earlier. Now, what's the relevance to someone with chest pain having diabetes? It's one of the risk factors that we worry about, especially when someone comes in with chest pain. So that's just a quick, I guess, little excerpt of how important awareness is in the medical field.
My name is Patricia Morissette, and I'm a fourth year medical student. I'm currently applying for residency positions. Today I wanted to discuss about women's place in medicine. I'm applying for orthopedic surgery, which is a very, very male-dominated field. So this subject hits home for me. I wanted to start off by introducing Elizabeth Blackwell. In 1847, she was the first woman to be accepted into medical school in the United States. She got accepted into Geneva Medical College in New York. Initially, the administration wanted to reject her application. However, as a joke, they decided to accept her, and their plans were to humiliate her. In 1849, she graduated as first in her class. So I wanted to read a couple excerpts from this book I've been reading. It's called The Side of Doctoring, Reflections from Women in Medicine by Eliza Lotion, just to demonstrate the general opinion at the time. So this excerpt is about Blackwell in particular. Her triumph unleashed a fury of protests within the medical establishment. One Boston physician lamented, "It is much to be regretted that she has been induced to depart from the appropriate sphere of her own sex, and led to aspire to honors and duties which by the order of nature and the common consent of the world devolved alone upon men. And this is the first case of the kind that has been perpetrated either in Europe or America. I hope, for the honor of humanity, that it will be the last. This is in 1849. And then I had a second excerpt that I wanted to read. A deep-rooted prejudice still pervaded much of the medical establishment, fueled by the theories of Harvard professor Edward H. Clark, 1874, who proclaimed that women who sought advanced education would develop, and quote, monstrous brains and puny bodies, abnormally active cerebration and abnormally weak digestion, flowing thought and constipated bowels, end quote. So although the position of women in medicine is not as discriminated against anymore, there still is a lot of blatant sexism. And I could discuss for hours about the infuriating issues such as lack of equality in salaries and job positions and promotions, and how even just getting a residency as a young female, there's always that fear from administrators that you're going to choose a family life or just get pregnant and leave the program. But instead of getting into all those issues, I just wanted to leave you guys with a thought of general consensus still in everyone's minds. I can wear a lab coat and walk into a patient room and introduce myself as doctor or student physician or medical student, and at least once a day I'll still get referred to as nurse. Now my fiance, Danny, is in the same position as I am, and not once has he been called a nurse.
Now that we've looked at awareness on the medical side of things, let's check out awareness in the business field. Being aware in business is a huge benefit and absolutely necessary. First, you need to be aware of your strengths and your weaknesses. If you don't understand what you're good at and what you're not good at, you're not going to be able to give your customers what they want. Second, you need to be aware of your competitors. If you don't know who you're fighting against for customers, how are you supposed to offer great products? Also, you need to be aware of your employee satisfaction rates. If you don't know what motivates your employees, they're not going to be very happy and not perform very well. Also, you need to be aware of your customer base. If you don't know who you're marketing to, it's not going to turn out very well. For example, you don't want to market Barbies to teenage boys.
Pretty sure we played with Barbies.
Stop at me from the past. Understanding awareness in every field is absolutely important, but the most important part of awareness is being aware of yourself. You need to understand your personal strengths and weaknesses, your personalities, and be aware of your emotions. Nathaniel Brendan said it best: the first step to change is awareness.